estrogen. When you lose estrogen, you see a lot of deterioration. You also see changes in the way we feel and how we function. Suzanne Summers, in her book on natural hormones, talked about the 7 dwarfs of menopause. Itchy, bitchy, sweaty, sleepy, bloated, forgetful, and all dried up. That's what happens when you lose estrogen. Well, many women see hormones cause problems and get scared, so they stop them. And when you stop them, you have to understand what's going to happen when you do stop hormones. There's complications to stopping them. We doctors don't tell you that. Oh, just go ahead and stop it, that's fine. But what you're going to find out is you're not going to feel very well, you're not going to function very well, you're not going to sleep very well, your quality of life will be changed forever. In addition, probably the most important reason that estrogen should be prescribed and taken and maintained at optimal levels is because of the protection. If anything you learn in this lecture tonight, it should be this slide. The most common cause of death amongst both men and women is heart disease and strokes. That is a preventable disease. Maintaining levels of testosterone and estrogen and progesterone in optimal ranges help protect against these diseases. Most doctors will not know any about this because they're looking at the estrogen that causes it and provokes it. That's the Premarin. They're not aware that every study on the natural hormones protects against these problems. Alzheimer's disease is a dreaded disease, memory loss, dementia. It is a preventable disease. Women that have taken estrogen for more than 15 years will not get Alzheimer's. That's a nice study that was done that was published in JAMA showing beneficial effects of protecting the brain, the heart, the blood vessels, your bones. Osteoporosis and fractures is a $1 billion deficit to Medicare every year. It'll also forever change your life when you realize you won't walk as normal as you once did. 50% of women over the age of 65 will die within 2 years with a hip fracture. Why? They get pneumonia. Why do they get pneumonia from it? We don't understand. But there's a tremendous increase in morbidity and mortality when our bones are thin. I'm an ER doc. I work in the emergency trauma center in Los Angeles. I see probably 10 hip fractures on a good 12-hour shift. All of these could have been prevented simply by maintaining optimal estrogen levels. But women didn't know that. We didn't know that. We doctors didn't know that. Now we do know it. This is a preventable disease. When you lose bone in your hip and your spine, you'll also lose it in your mouth. And when the bone structure starts to expand, the tooth is not held in place because you lose the bone that holds it in place. So most women after 15 years will lose a tremendous amount of teeth. You'll get urogenital atrophy, vaginal dryness, chronic urinary tract infections, incontinence. You sneeze, pardon me, you pee. You laugh, you pee. Why? You have urogenital atrophy. You've lost the muscle tissue. You've lost the innervation, maintaining the good mucus flow down there. Macular degeneration is the #1 cause of blindness in our society. It is a preventable disease, and it's related to estrogen. Estrogen protects against it. Similar to Alzheimer's in the brain, estrogen protects the nerves in the back of the eye. There's also a decrease in colon cancer for those women that maintain good levels of estrogen. So there's a lot of health benefits when you have estrogen, and there's a lot of detriments when you lose it. Estrogen replacement also. It decreases hot flashes, the night sweats, the depression. Is any women in here concerned about wrinkles? wrinkles in their skin. Why do older women have such thin, papery, thin skin? Because they lose collagen. What helps maintain collagen? Hormones. Estrogen is one of them. Vaginal dryness. I hear this complaint on a daily basis. Well, you don't have any estrogen down there. It's going to dry and it's going to shrivel up. Sex is going to be very, very difficult. Chronic atrophy and incontinence are the typical of estrogen loss. Increase in quality of life, sex life, memory, and skin, all with estrogen replacement. If you don't mind losing a little bit of your memory, you don't mind your skin becoming thin and wrinkly, if you don't mind having less of a quality of life, then go ahead and stop the estrogen, that's fine. If you want to maintain good quality of life, and how you look, and how you feel, and how you function, and improve longevity, then you need to be on optimal levels of estrogen. In every study to date, taking estrogen has shown an increase in longevity, decreased heart attacks, strokes, dementia, Alzheimer's, and osteoporotic fractures. This may be a little confusing, but don't confuse estrogen replacement therapy with the synthetics as the same with the natural hormone replacement therapy. They are different. Don't confuse. Preminin and Provera as being natural estrogen, natural progesterone. They're not. They're completely different. So again, synthetic versus natural, bad, good. Chemically altered, biologically identical, molecularly the same. Synthetic is derived from the urine of pregnant mares. The natural bioidentical hormones are derived from plants.